Hi, I'm Neil Hanon. I'm a psychiatrist here in Canada. I am the lead trainer for Grof Legacy Training International here in Canada. In Canada, we train psychedelics under the name Grof Psychedelic Training Academy, and we teach Grof Breathwork under the name Grof Breathwork Training Academy. I'm just going to explain a few of the differences between the whole variety of different types of breath work that are out there and what distinguishes Grof breath work as a particular form of holotropic breath work. First off, Stan and Christina Grof developed holotropic breath work in the US initially at Esalen in the 70s and 80s, and then taught it all over the world. It was originally taught under the brand name Holotropic Breathwork, but Stan and Brigitte Grof developed Grof Legacy Training International in 2020, and now all breathwork related to Stan and the way that Stan and Brigitte want it to be trained is trained under the brand Grof Legacy Training International. Now, it's very important to distinguish Grof breathwork from other breathworks because Grof breathwork is modeled on 60 years of Stan's work with psychedelics and non-ordinary states of consciousness that lead towards wholeness, that he coined the term holotropic for. Holotropic means moving towards wholeness. Grof breathwork is 3 to 4 hours long and is done in pairs where one person is the breather and one person is the sitter. It is usually done in groups with one facilitator for every 8 to 9 participants, and usually done in a male-female pair of facilitators. The sitter for the individual breather takes care of basic needs such as tissues, water, giving the person water when they ask, etc. Now, the preparation for the breath work is pretty well hour for hour in terms of the duration of the breath work, which is 3 to 4 hours. So preparation is about 3 to 4 hours. And this is another area where Grof breathwork is very, very different, because in that preparation is teaching about the entire cartography of the psyche and what could be encountered in the person's own sessions when they encounter their own psyche, as it is showing them how to move towards healing and wholeness. Now, the breathing itself is simply faster and deeper with less time between the in-breath and out-breath. Once the person starts their breathing and they enter into a holotropic state of consciousness, then there is no coaching about their breath. The person's breathing just returns to whatever seems to be normal for them. So unlike many other types of breath work where coaching is happening all the time through the breath work and there's talking all the time through the breath work, that is not the case for Grof breath work, or really any type of holotropic breath work. Also very different in Stan and Christina's model of breath work is the concept of body work. Trauma is stored in the body and manifests in non-ordinary states of consciousness or holotropic states of consciousness as tensions, pains, tremors, etc. So the breathers are encouraged to let their bodies shake, move, do whatever their body feels like it needs to be doing at the time that they're in this holotropic state. If they have particular pains or muscle tensions, then they ask for body work. Now, what body work is from the facilitators is the facilitators produce a resistance for the breather to push against. And it's so the body work pressure is always under the control of the breather and not under the control of the facilitator or sitter. And they are encouraged, the breather is encouraged to express in any way that it feels like that releasing pressure feels like it needs to be released. Often with grunts or growls, etc., coming from their voice. Another very different part of Grof Breathwork is the music. The music has very distinct and important sequences. The music is to last 4 hours long in case anybody's session lasts longer than the 3 hours and goes into the 4-hour time frame. The music starts out as an invitation music, then trance music, then heart music, then climax music, then return music. And each part of the music sequence has a certain amount of time attached to it, a certain emotion attached to it, a certain driving quality attached to it, etc. It takes a long time in the training to understand how the music actually needs to be put together to develop music sets for Grof Breathwork. Then after the session is done and the breather is checked out by the facilitator to make sure that they are done their session, to make sure that there are no unfinished gestalts, then the breather is encouraged to go and draw a mandala. And the mandala is the first part of bringing into this reality what the person experienced in the holotropic reality. And we encourage them to do that in any which way that feels comfortable for them. They may just put colors on the page. They may have a whole sequence of events that they put on the piece of paper. They may put a big heart on the piece of paper. It could be any variety of things, but it is bringing the experience into this reality. Then after that is done, then there is a sharing circle. And the sharing circle is organized by the facilitators and has all of the participants involved, the sitters and the breathers. And if only one session happened that day, then the people who were the breathers talk about their session. They take 3 to 5 minutes to just talk about the highlights of their session. Again, this is bringing the experience into this reality and is the beginning steps of the integration of the experience. It is very important to note that the sharing circle is sharing. It is witnessing by the other participants of that particular person's experience. There is no therapy done during the sharing circle. There are no interpretations done during the sharing circle. Sometimes facilitators will mention places where people can look up different symbols that came into their journeys, or different gods or goddesses, how to look them up and how to see how it applies to their session. It is hoped that each person in their experience also has a therapist that they can work with that understands holotropic journeys. But that happens outside of the breathwork session. Without access to body work, it is not Grof breathwork. The person in breathwork needs to be able to have the releases that are necessary. Sometimes there are errors of omission, meaning the person in their personal biography, they did not get what they needed to get at a particular time. And during breathwork, they may regress and they may need to be held as a mother holds a young child. That can be a powerful corrective experience for the individual who is in the breathing session. No sexual contact is allowed during the retreats or during the breathworks themselves. So it is really important that the person be in a regress state if any behaviors like the correcting the sins of omission happen. The person has to be in the regress state that the omission did not happen. Otherwise, it cannot be therapeutic. Grof breathwork can also not be done by video. In fact, any type of breathwork is actually dangerous if it's done on video, because the person can get into an unfinished gestalt. And what we mean by that is the person may uncover unconscious psychological material that then surfaces, can have a whole variety of affects, emotions attached to it. And without it being resolved, the person can stay frozen in that state for hours, days, weeks, even years, until they go back into a holotropic state with somebody who knows how to help finish a particular gestalt. And that is very, very important and distinguishes Grof breathwork from most other types of breathwork. The cartography of the psyche is also very important as an element of understanding in Grof breathwork. The Stan's cartography of the psyche includes the biological, the biographical. By biographical, what we're talking about is the person's biography from birth to their present point in their life. That is the standard of Freudian psychoanalysis, cognitive behavioral therapy, etc. Most therapies function on the biographical. Then there is the perinatal part of the Stan's cartography, which he discovered in his many sessions with psychedelics, with LSD especially. Stan sat for around 4,000 to 5,000 LSD sessions, and he discovered that people went into various parts of their birth process, and these were linked with parts of their biography as well as parts of the transpersonal realm. And those perinatal parts are Stan called basic perinatal matrices. Perinatal matrix 1 is before labor starts, the fetus is in utero. It's usually wonderful, although there are toxic stages if the mother was a smoker or substance user as well. However, for most individuals, the basic perinatal, the first basic perinatal matrix was oceanic, very beautiful, very wonderful, warm place where all needs were taken care of. Then with the onset of labor, it is a no-win, no-exit situation. then as the cervix starts to dilate and the baby starts being pushed into the birth canal, that's the basic perinatal matrix 3, and there is hope in between contractions. And then BPM 4, or basic perinatal matrix 4, is when the baby is actually born and is pushed into this reality, into the arms of their mother, hopefully onto the breast of their mother. And that is an absolutely wonderful experience for the baby. There is another realm, which is called the transpersonal realm, that is often experienced in non-ordinary states of consciousness or holotropic states of consciousness. And that transpersonal realm, all of the things that we call, all the places and experiences that we call non-ordinary, unable to experience in this reality unless you're in a non-ordinary state of consciousness. And so that is experiencing gods, goddesses, all kinds of beings, ancestors, previous lives, different karmic memories, experiences of being animals or microbes or a tree, or almost anything that is out of the context in this current consensus reality. So, interestingly enough, in stance cartography, there are such things as coexes, which are a linking of the personal biography with a particular perinatal matrix with particular experiences in the transpersonal realm. And those are important for facilitators to recognize, because it's important to recognize after the fact, when a person has finished their holotropic journey, where they were, to help them understand if you are going to be doing integrative therapy with a person who has had a holotropic journey. So that's basically what I wanted to portray in this particular video.